Knock, knock. Good morning. Pulling the privacy curtain. My name is Elise, and I'm your nurse today, and I'm here to do an assessment on your baby. Can you verify your baby's name and date of birth for me? Okay, very good, very good. So how are you doing today? Okay, good. Okay, that's good. And how's your baby been eating? Has your baby been eating okay? Good, very good, very good. And put my gloves on here. And we're going to start doing an assessment on your baby. Okay. Trying to put so you can see. Okay. I'm looking at the baby's head here. I'm looking at the baby's suture line. Okay. And while I'm looking at the baby's suture line here, I'm checking the fontanelle. And the fontanelle is flat. Okay. And that's how we want it to be. Okay. I'm looking at the baby's ears. Okay. The baby's ears are lining up with the eye there. The other ear is lining up with the eye there. So the ears are even and symmetrical. The eyebrows are look good. There's no edema there, and they are even and symmetrical. The baby's face is even and symmetrical. Okay, now I'm going to look at the baby's eyes. I'm going to use my pen light. I'm going to look at the baby's eyes, and I'm checking the sclera and the pupils in the eyes, which everything looks good. The sclera is white like it's supposed to be. Okay. Now I'm going to check the baby's nostrils. And I'm going to press one down here. And this is normal. The babies breathe fast. Okay. That's good. I'm pressing down here. That's good. Okay. There's no drainage. I see no drainage coming from the nostril. Okay. Now I'm going to take my finger and put my finger in the baby's mouth. And I'm looking at the ova. And I'm checking for cleft. And while I'm doing that, I'm checking the sucking reflex. And the baby has a good sucking reflex. And this is a quiet baby. You're just a good baby. Now I'm going to put my finger right here. And I'm going to rub the cheek. The baby responds by turning his cheek towards my finger. This side, okay, is the baby's reacting. Okay, so now I'm going to check the baby's neck. Okay. I'm looking at the folds of the baby's neck there. Okay, everything looks good in the clavicles there. It's the way it's supposed to be in the neck there. Okay, now I'm gonna check the baby's reflex here. Check the baby's reflex. Okay, all right. The baby has a good reflex. I'm looking at the baby's fingernails. There's no blueness in the fingernails. And the baby has a good grip. Checking that for that also while I have the baby. I'm going to check the baby's fingers over here. The baby has good grip. There's no blueness, no cyanosis there. Noted there. Okay. And everything looks good there. Baby has good grip. Looking in the brachial area here at the folds. Checking the folds. Checking the muscle tone. Okay. I'm going to get my stethoscope. And I want to listen to your baby's heart rate. Okay. And we listen to your baby's heart rate for 1 full minute. Okay. Okay, very good. Okay, now I'm going to listen for the sound of S1 and S2. Okay, S1 heard, S1, 2. S2 heard. Okay, very good, very good. Okay, let's see. Here, okay. Now, I'm going to go down here, and I'm going to check the baby's tone and the baby's feet and legs down here, okay? Okay, the legs are even. They're even. They're the same size. I don't see any. There's no clubbing. There's no clubbing in the feet, okay? All right. I'm looking at the folds there, there. I'm going to check the baby's toes to see if the baby's toes curl around my finger, okay, which is good. The baby did. Check the baby's reflex by rubbing the bottom of the feet, okay. I'm going to go over here and do the same to the other foot, okay. The baby curled around my finger, which is good. Check the reflex by rubbing the bottom of the baby's feet. Everything's okay, there. I'm looking at the capillary refills on the baby's toes, and everything is good there, and there's no blueness, no cyanosis. Okay, same here with the other baby's foot. Okay, good, good, good. Everything's looking good so far with your baby. Now, I'm going to turn the baby over, and I'm looking at the curvature of your baby's spine. Okay, baby spine. You see that? Okay, and there's no, everything's fine. Everything's normal within the baby's spine. There's no spots, no dimpling back there. Okay. Oh, I see a little bit of meconium there back there. We got to take care of that. And that, by the way, looked at it's thin and tarry. It's like a dark green tarry. Okay, not that much, but there's a little bit there. Okay, looking at the baby's hair. Okay, the baby's hair on his back is thin and just like we want, it's hairy. And looking at the legs too, the baby has hair there. And looking here, the baby's hairline is fine and it's thin, and same here. Okay, so now we're going to take the baby's diaper down, and I want to check the groin area, okay, on your baby. Check the groin area on your baby. Okay, all right. The dimpling is fine. Little baby has, there's slight discharge because she's a girl, so she has vaginal discharge, which is thin. It's just a little bit, and that's normal for your baby to have that. Okay, I'm checking the creases in the baby's legs and the baby's groin. Okay, and we're gonna take and do like that a little bit. Everything seems normal there. Oh, baby, I finally heard a little cry. I finally heard a little cry from you. Okay, now I want to listen to your baby's abdomen, and I'm checking the baby's bowel sounds, okay? Okay. So I'm going to take my stethoscope, and I'm going to take it, I'm going to put it here. Go here. Listen there. Listen there. Listen there. And listen there. Okay, good. Okay, I heard bowel sounds in all quadrants. I'm looking at your baby's umbilicus area, and everything is fine there. And make sure you take care of this and wipe this with alcohol, okay? And you're not going to give your baby a bath until after this falls off. When the cord falls off, then it's okay to give the baby a bath. But right now, everything looks fine within the umbilicus area, okay? So you don't have to worry about anything there. Okay, baby looks good. And while I'm at it, let me check the baby's temperature. I'm going to check the baby's temperature. Check the baby's temperature. If the camera can see me. Checking the baby's temperature. By placing my stethoscope up under the arm. Okay, all right. Your baby doesn't have a fever. Everything's okay with the baby so far there. Let's pull the diaper back up. And I'm going to stand your baby up. Okay, I want to check the baby stepping, okay? How the baby steps. Baby steps. Okay. Baby has good... Ooh, the baby's trying to walk. Ooh, this baby's going to walk. Ooh, you're going to walk pretty quick there, huh? So everything looks good there. Okay. Everything looks good with the head. You know, there's no crepitus up there. No crepitus was noted there. Okay. Baby has good reflexes in both arms, toes, legs. Okay, so everything looks good there with the baby. Let's do this a little bit. Let's do this. Okay. Oh, I'm sorry, baby. I'm almost done with you. I just want to check you there. Okay. And do a little this. Take your legs here and move them here. I'm just checking for tone and reflexes mainly with your baby. Okay. I know the baby is uncomfortable there. They don't really like that much. They want to be bothered. Don't want to be bothered that way. So everything so far looks good with your baby. Okay. I don't see any problems with the baby. Are you feeding the baby okay? Is the baby latching on okay? Okay, that's good. All right. So I'm going to give you back to your mom, okay? So, and if you have any questions or you need anything, you just call me. Your call light's there in place right by you, okay? I'm going to hand you the baby and put your bed back down. And take my gloves off. Wash my hands. Open the curtain back up. Okay, Mrs. Washington, so if you need anything, you just call me and let me know. But one thing I did want to check, just real quick before I leave, because I didn't check. I wanted to look at the lip area around the baby's mouth, and make sure I had everything down there. Okay, the baby's lips are pink. Okay, and the oral mucus on the baby, is moist, and everything's moist there. There's no cracking around lips. I just needed to check that, because I didn't do it. So I checked it now, so everything is fine, and your baby's chest is even and symmetrical, okay? So I don't see any problems there with the baby, okay? And before I leave out, and my hands are clean, I just want to check one thing. Okay. I'm just listening to your baby's lungs, just to make sure I didn't hear anything. Because I checked the heart rate, and I checked your baby's for bowel sounds, and listen. Okay. Baby's lungs are clear. Okay, I don't hear anything there. Okay, so that's it for your baby. I'm done with your baby. And okay, so just call me, if you need anything, and I'll be back in an hour to check on you and the baby. Okay?